In this video we will talk about catheterization. It is the insertion of tube or a catheter through the urethra into the bladder, so that the urine passes. Purpose of catheter. Relieve urine retention. Empty the bladder before, during, or after the surgery. Allow accurate measurement of urine output. Types of catheter. Number 1 is indwelling catheter or Foley catheter or retention catheter. It contains 4 different types of catheter. Female catheter. Pediatric catheter. 2-way catheter. 3-way catheter. This type of catheter is placed into the bladder and secured there for a period of time. Discontinue after 24 to 48 hours, after that it is removed. Parts of Foley catheter. Now we will discuss about the parts of catheter. First one is balloon part. From this distilled water is inserted so that the catheter do not come out. Second part is bladder opening. From this urine moves into the catheter. Third part is urine drainage port, which is connected to the uro bag for the collection of urine. Next one is rubber catheter or in and out catheter, or non-retention catheter. It is used to drain the bladder for short periods, that is for 5 to 10 minutes. It may be also inserted by the patient itself. Next is suprapubic catheter. This type of catheter is inserted into the bladder through a small incision above the pubic area. It is used for continuous drainage. Procedure. First we will discuss male procedure. Position should be supine. Clean the penis and retract the foreskin. Lubricate the catheter from 12 to 18 centimeters. Insert 7 to 9 inch. Use sterile water 10 to 15 milliliters. Balloon capacity is 10 to 30 milliliters. Next is female procedure. Position should be dorsal recumbent position. Cleaning from front to back genital area. Insert 3 to 3.5 inch. Use sterile water. 10 to 15 milliliters. Balloon capacity is 10 to 30 milliliters. This was all from this video. I hope you liked this video.